Local physicians and their patients are urging Texas leaders to cancel state budget cuts that threaten vital health care. Here to explain why the outrage is Dr. Victor Gonzalez, president of Hidalgo Starr County Medical Society. Welcome. Doctor, can you break down this problem for us? What is going on? What do people need to know about it?
I think the important message that we need to get across, Amber, is the fact that unforeseen consequences of some of the policies in Austin have resulted in an inability to have our local physicians keep their doors open. A combination of the cuts linked with problems with some computer glitches have resulted in physicians seeing patients for at least 3 months now, not having received any type of income and what we call a dual eligibles. The cuts are important because they threaten our ability to continue to keep our doors open. As a result of that, patients may not have the health care that they need.
We have a unique region down here. So many people depend on Medicare or Medicaid. Talk to me about the dual eligibility. It's, what I understand, the poorest and then the oldest people are going to be the most affected here from these cuts.
That's correct. You know, Medicare is one of the components, and they're either you're of the age or you're disabled. In order for you to qualify for Medicaid, you have to be below the national poverty. So it's the elderly, the disabled, and the poor.
And that's what most physicians here depend on as their clientele. Well,
because of the demographics, you know, yes, the valley and the border area has very unique demographics, and we do have a high number of those type of patients.
And what's at stake here? Doctors actually leaving, not wanting to stay here.
Well, the problem is, Amber, it's very simple. If you do not have enough income in order for you to maintain your offices open, meaning pay your staff, buy supplies, there's no choice. And I think we've come to a point where at that level, these cuts have been significant. These cuts will have very negative impacts on people's ability just to keep their doors open. And unfortunately, the real loser in this whole problem is the patient. And that's what we're trying to avoid.
It's a business model that you just can't fit anymore.
That you can't fit anymore. It's like any other business. If you don't have the income for you to keep your doors open, you move on. And unfortunately, that's what we're trying to avoid.
Well, we have ways that people can actually help here in the Valley. We're going to talk more about that in our next hour. We'll be right back.